Question is, how can I tell the difference between an experienced Medicare broker and an inexperienced Medicare broker? Well, I think the first thing is when you meet somebody who is a Medicare agent, um, just ask them some questions about how did you get in this business, and what companies do you represent? Do you work outside of our community? How long have you been doing this for? What's your background? Um, how many companies do you represent? Those are questions that show the breadth and the depth of the understanding of the Medicare agent. The other thing that is a telltale sign for me all of the time about somebody's capacity as an agent is if they say, I do Medicare. Somebody does not do Medicare. Medicare is a profession that highly skilled CFPs like myself, MBAs like myself, people who have degrees in finance, they choose to work in the very fine detail of protecting people when it comes to their health coverage so that they don't go bankrupt. That's our job, is to make sure that you not only have access to the best possible care, but you don't go bankrupt. And that's more for the under 65s because our Medicare policies are pretty sewn up, but you can still get in very, very deep trouble. So, length of tenure. How many companies do they represent? How long have they been doing? What is their academic background? Ask them their ID number. You can look that up on the California Department of Insurance, amongst others. How many other states do they involve, and do they represent at least five or more carriers in each line of business, which is drug plans, which is Medicare plans, which is supplemental plans, which is dental plans, and which is vision plans. Now you've got somebody who has something truly to offer you that you can't just go and get off of the internet. Some people like to go off of the internet and go and hunt and peck and find things, but babe, when you get people like us that have been doing this for 20 years and we have advanced degrees and we have the wherewithal. We've been working with families for years. Why would you sell yourself short and not use a professional? We don't cost anymore. The other item is if that person is dying to come to your house and knock on your door, run the other way. That person needs to have an office if they're a legitimate person. They work from their kitchen table. They're a low budget person. Get a good one.